Now that we've covered assessing workplaces and ourselves and the mechanics of preparing for the actual interview, it's time to discuss what a prioritized strategic support plan for negotiation looks like. In every job negotiation, there are three factors at play. The first are your needs. The second are employers' needs. And the third, I call the force. It's the negotiated outcome based on both of your priorities. People don't always embrace this, but you can walk away from an offer if you feel it's not the best offer for you. So let's dive into negotiables and prioritizing them. Here you'll see an example of some of the most common things APRNs negotiate for. However, it's also important for you to remember your needs and wants. You need to be clear on what your A, B, and C priorities are in a negotiation, because if you're not, you might end up getting a bunch of things you didn't really care as much about, but later missing those things that you really did care about. So let's start with the A list, your must-have negotiables. If you're an APRN and you're being told by an employer that you're going to have a large panel size, perhaps you want to prioritize asking for more nursing or MA support in the beginning as you ramp up in the first 3 to 6 months. Or you may want to specifically bargain regarding the ratio of admin time to patient care time. For example, they could start by telling you that you get 4 hours of admin time for every 16 hours of patient care. Is that enough admin time? To start this negotiation, you could start by, what is a typical panel size? Now, here is what a B list looks like, and these are things that you're willing to compromise on. So, they're important to you, but there's some room. Your C list are things that would be great, and here's what it could look like. It'd be great if I could have a parking spot, but maybe that's kind of outside the realm. So it's really important to think about, what would you put on your A, B, and C list? Now that you're familiar with a list of what you can negotiate, let's see how our alum, Monifa, negotiated a lower panel size for herself.
That's another question, is asking what is the typical panel size for caseloads. I overloaded myself for sure. And so I really had to go to my supervisor and say, hey, I have way too many patients on my caseload, and kind of negotiate turning the faucet off so that I could kind of get my footing again. So really the approach was, my patients can't make a 1-month follow-up appointment. In fact, it was to the point to where they couldn't even make a 2-month follow-up appointment. And based, in my specialty, that's something that has to happen for good patient care. So my panel size at that point was no longer falling in the standards of good patient-centered care. So that was really, I didn't make it about me being exhausted or me being this. It was about, and which was true. It was about that I don't feel like I'm able to give the proper care to the children and families that I'm serving right now, on how many families I'm holding.
There's a reason that we use professional standard competencies to assess ourselves. When you're struggling as a provider, everyone is at risk, the patients as well as you. Therefore, standards of care are there in order to protect both you and your patients in cases where you realize that those standards are in jeopardy of not being met. However, also be aware of what is considered standard in your practice community. Employers can understand a new graduate needing more time and resources, but if others who have gone before you have gradually been able to come up to speed with the appropriate support, you will be expected to do so as well. So the way you need to negotiate for things like ramp-up time or admin time or lower panel size are to be honest with yourself and your supervisor about how your learning curve could be best supported to get you up to speed and feeling confident. Be direct and have a plan for what you need to get on track, like Monifa did. Now, for your homework, it'll be your turn to negotiate your support plan. Using the negotiating support handout, fill out the Your Turn column first, then practice asking and answering negotiation questions with colleagues at some other point. One person should play the employer and the other should play the applicant for that activity. Getting comfortable asking questions is half the battle. And that brings us to the end of this presentation. Please be sure to contact OCPD for more help, and good luck in your job search.